Why is contrast dye used for a pancreatic CT scan? Imagine trying to see a detailed map in a foggy landscape. Without clear markers, it's hard to tell where one place ends and another begins. That's similar to what a CT scan does for your pancreas. It creates detailed images of your internal organs, but sometimes the structures can look very similar. That's where contrast dye comes in. It acts like a highlighter, making certain tissues stand out more clearly. In a pancreatic CT scan, contrast dye is usually given through a vein. This iodine-based dye travels through your blood and makes blood vessels and organs more visible on the scan. When the dye is in your bloodstream, it increases the brightness of blood vessels and tissues, helping doctors see the fine details. This is especially important for the pancreas because tumors often have less blood supply than normal tissue, making them harder to spot without contrast. The contrast dye helps differentiate between healthy pancreatic tissue and any abnormal growths or tumors. It highlights blood vessels, so doctors can see if a tumor is involving nearby arteries or veins. This information is crucial when deciding if surgery is possible or if cancer has spread to other areas like lymph nodes or the liver. The dye also helps identify the different phases of blood flow, such as the arterial phase, which shows arteries, and the venous phase, which shows veins and the pancreas itself. This multi-phase imaging provides a clearer picture of the tumor's size, location, and relationship to surrounding structures. Sometimes, oral contrast may be used to outline the stomach and intestines, helping to distinguish these from the pancreas. But the main role of contrast dye in pancreatic scans is the intravenous iodine-based dye that enhances the visibility of blood vessels and tissues. Using contrast dye improves the accuracy of diagnosis, staging, and treatment planning for pancreatic cancer. It allows radiologists to see details that might otherwise be missed, leading to better informed medical decisions. Of course, because contrast dye can cause allergic reactions or affect kidney function in some people, healthcare providers carefully evaluate whether it's safe for each patient. They consider factors like kidney health and allergy history before administering the dye. In summary, contrast dye is a vital tool in pancreatic CT scans because it helps make the images much clearer. It highlights blood flow and tissue differences, making it easier to detect tumors, assess their spread, and plan appropriate treatment. This approach aligns with established medical guidelines for diagnosing and managing pancreatic diseases, ensuring patients receive accurate and effective care. Always remember to discuss any concerns with your healthcare team, as they can provide personalized advice based on your health.